Hello. So let us look at this question here. Explain the normal splitting of second heart sound and mention causes for its wide splitting. So you can see that they have asked this for 3 marks. And now let us first understand second heart sound. In second heart sound, let us see why there is normal splitting, and then we will look at the wide splitting. Okay. So where are the valves? First you have to locate them. So we are looking at the S2. See, S1 happens when mitral valve and tricuspid valve close. Okay, so only closing makes sounds, remember. So mitral valve, tricuspid valve closure will give you S1. S2 is because of aortic valve and then pulmonary valve, S2. So we are saying A2P2. Okay, this is S2. Second heart sound, this is S1, first heart sound. Okay, so only closing makes the noise. Okay, remember, only closing of the valves makes the heart sound. Okay, so A2P2. Now, where is A? A is here. This is the aortic valve. That is the where is the blood going? Into the aorta. And this one is the pulmonary valve. So they're shown in blue. Blue color means what? Deoxygenated blood. Where is it going? It is trying to go to the lungs, pulmonary. Okay, so this is the pulmonary valve. This is the aortic valve. Remember, A comes first and then P2 comes in the sounds. Why? Because the left ventricle empties faster. Because if you look at the way the electric conduction happens, look at the electric conduction here. So L is getting faster, looks like. So what happens? It will squeeze the blood and close the aortic valve faster. And then only the pulmonary will get closed after the right ventricle empties. Okay. So first which sound you will get in S2? You will get A2. A2 will come, then P2 will come. Okay. So here in heart sounds, you will say S2 is what? S2 is nothing but second heart sound is nothing but A2P2. Okay, so this is A2P2. Now, why is there normal splitting between A and P? So during expiration, what happens? It will be like this: A2P2. Okay, something like this. This is the sound, and this is the next sound. Right? They're very, very close in expiration. But in inspiration, when you auscultate, you will get A2P2, slightly separate. Why? Because in inspiration. So this is the normal splitting of second heart sound. Did you understand, guys? It's just inspiration. Okay, normal splitting of second heart sound is because of what? Inspiration. Okay, so this is the one that we are trying to draw your attention to. S1 is M1 T1 closure. S2 is aortic valve closure and pulmonary valve closure. But A comes first. Why? Because left ventricle will empty and close the aortic valve sooner. Okay. And when you inspire, what will happen? P2 will go further beyond. Okay. So P2 will go a little further beyond. So this is the normal splitting of the second heart sound. So if you match this with ECG, S2. S2 is coming. S2 is here. S2 comes after the end of systole. Okay. The single on expiration. On expiration, there is no split at all. Okay. Then, why does this happen? Because of closure of aortic valve and then the pulmonary valve. Aortic will close first and pulmonary will close next. But in expiration, they're saying there'll be no difference at all. Both of them will be at the same time. Okay, A2P2. Now, why will it be abnormal? Now, let's look at that part. So, guys, we have finished the first part of the question. Normal splitting of S2. Okay, so you will say that S2 is because of A2P2, that is aortic valve closure and then the pulmonary valve closure. And the normal split in this is due to inspiration. Okay, this much you have written now, correct? So normal splitting of second heart sound explained. You will get 1 mark there. Now, mention causes for its wide splitting. So why will it split? Wide splitting, why can it be there? That is A2, let us say, is here and P2 was supposed to be here in inspiration, right? That is okay. But why A2 is here now? P2, which was supposed to be here during inspiration, has gone even further somewhere here. That means pulmonary valve is closing late. So did you get this? So now you think, pulmonary valve, why will it close late? So look at this diagram, you will understand. Where is the pulmonary valve? Here, right? Now here, pulmonary valve, why will it close late? That means the emptying of the right ventricle happened late. Why is the right ventricle not emptying properly? That is because of right bundle branch block. Okay, so that is the answer that you will say. So here you have the right bundle branch, right? Now this right bundle branch, there's a block, so it is not passing the signal soon to the right ventricle. So the right ventricle is emptying even more slow, and the pulmonary valve is closing slow later. So the sound is coming later. So there is a wide A2P2 separation. Okay, so that is the answer here. The answer is what? Right bundle branch block. Right bundle branch block. Okay, so because of which there is a wide split in the S2. Okay. Now, what are the other reasons? Because here we are seeing only one reason in the textbook. However, they are asking in the exam multiple reasons, right? So if you see here, they're asking in plural. They are asking in plural, mention causes for its wide splitting. They're not asking one thing. Causes they are asking. Multiple. So here, though the textbook doesn't say that, some reason that this emptying of right ventricle is happening slowly. That is because of some problem with this pulmonary part only. So either there is pulmonary hypertension, that is the lungs, no, they have some the pulmonary hypertension is there, it's not able to push, or there is some stenosis of the valve. So the valve is slightly narrow. So what will happen? Less blood can go. So the right ventricle empties much slowly. That time what will happen? This blood will empty slowly, and then the pulmonary valve will close later on. So the P2 will move further ahead. So there wide splitting between S2 and P2. Sorry, A2 and P2. See guys, whenever these are there, no, there'll be some additional things like murmurs may be there. Okay, some extra sounds also may be there. Okay, for now you remember right bundle branch block is the correct answer here for the wide split. What is the answer that you will write? Right bundle branch block is the reason for the S2 wide split. That is A2 P2 wide split. It is right bundle branch block. Why? Physiologically, it is because of inspiration. Okay, pathological, why is it? Because of right bundle branch block.